Many thanks, Catherine. Hi, everybody. I'm Nick McClelland, and I'll let Wolfgang introduce himself in a moment. As Catherine's just intimated, we're going to talk today about personality, identity, behaviors, but also about how that fits into corporate culture. And so how we're going to address that is that Wolfgang is going to probably look at the science stuff, because he's qualified to do so, and I'm definitely not. But I'm going to start taking you through a bit of an example of a real conversation that's happening at the moment with a real client who's here today. I don't think they're in the room. I hope they're not, in a way. To take that through into a real example of how we can try and capture the imagination of everybody in an inclusive way. So we'll cover a few different things. We haven't rehearsed. Wolfgang and I met two months ago, I think, as the coming together of JLT and Mercer. So we're here today bringing the best of both worlds, research from both parts of the business, to hopefully bring some different insight into this particular world. But I'll hand over to Wolfgang to take you through some aspects beforehand.
Thank you very much indeed, Nick, and thank you, Chair, as well. You know, I have done this job in health management for quite a while, and I think there are two holy grails in health management, and one is return on investment calculations, and the other one is behavior change. And when you talk about behavior change, the big aspect that comes into play is personalization. And we have personalization of benefits, and benefits experts are directionally talking about sort of an audience of one. That's where we want to go, that's where we want to communicate. Simultaneously, interestingly enough, medicine has become much more personalized, and you can see that you do genetic screens and you base your drug treatments, particularly in cancer treatment, based on those, so it's becoming more personalized. And what is enabling us to do even more of that is, of course, tech. And then there is this caveat that we just heard before as well, that not everything that is tech is necessarily meeting people's expectations who want to still be having a face-to-face conversation. And there's nothing better than to start a conversation like that on a very happy note, like a system of decline. That is our current well-being journey. And that's my way of rattling off a few statistics that mainly come from Britain's Healthiest Workplace and from PITC's survey, Mental Health at Work, that we are both very much involved in from Mercer, Nick and I. And what do we see there? We see that 61% of people say that they have mental health issues that are at least in part due to work, if not fully due to work. And we have this other issue about financial well-being, that 34% of people say that their finances negatively affect their mental health. Now, what's the consequence of that? You would ultimately be, of course, sleep deprived, and we could have a whole seminar on sleep deprivation here, and we could identify every single organ in the body that is affected by sleep deprivation, negatively affected, unfortunately. So in a way, it's the new alcohol, even though alcohol hasn't gone away, but that also creates similar problems. And then ultimately, what do I do when I'm sleep deprived? I wake up the next morning with those typical carbohydrate cravings, and I want to eat food that is not healthy for me. If I do that long enough, I might predispose myself to something that's called diabetes type 2, and which is the biggest ticking time bomb in the UK in terms of chronic diseases. 850,000 people suffer from it without even knowing it, let alone the other millions who do know it. And once you are treated, that's fine, but if you don't know about it, there is a challenge. And physical activity is another one that is the obvious culprit that we all know about. And so we end up with about 30% of people having at least one chronic condition. So that is just there to sketch the background and why behavior change is so enormously important, and why Nick has dreamed up a methodology of doing it much better in terms of benefits design.
It's a very positive note to start on. So basically it's all messed up, and we don't necessarily have a way to solve that. And I think the problem is at the moment in the industry, and guilty of this for a long time, being on the consultancy side of the employee benefits world, we look at how we can approach that. And what I've got on the screen now is what typically happens. Whenever an organization decides we want to do something about well-being, they look at a couple of different things. The first thing they look at is data, normally through some sort of survey, engaging the employees, engaging them through focus groups, whatever it might be, and ultimately you end up with two things. Possibly a nice core set of data from a survey, possibly some claims analysis on the physical health of people through the medical insurance policies and so forth, and then maybe some anecdotal feedback, maybe through from your people directly who are coming to you because you've got an open culture where that happens, or through focus groups, as we mentioned before. And then ultimately, we come up with some solutions. Those solutions today tend to follow that program. Education. So we think, okay, we've got a problem, so we're going to go in and educate, whether that's financially, whether it's nutrition sessions, whether it's launching mindfulness within the organization. We see that as the answer. We maybe look at technology, benefit platforms, software solutions, the plethora of apps that are now available that we all know can play a huge role, but again, we launch them very quickly to try and solve the issue, and then we'll try and underpin it with a communication strategy. But in my experience, and I meet a lot of businesses every day, we don't often ask a really important question, and it's really about purpose. Why are you bothering? And I think this is really important because I think if I'm looking at this room today, this is the kind of choir and the converted, so to speak. I think if I was asked that question, I'd expect to get the right answer. And I'm going to leave it for you to think about it for a moment. But if you're in this space where you want to just tick the corporate box of well-being and be seen to do something because your employees have fed back from a survey and through a focus group, that's okay. That's where you are. That's where your organization is today. Are you going to have a particularly strong culture of well-being? Probably not. But that might be where you are. Now, I imagine everybody in this audience is probably going, well, of course, that's not what we want to do. We want to do more than that. But I'd expect then, hopefully, you'd think yes to this answer. Do we really want to support our people's well-being? Whether you look at that through the financial lens, whether you look at it through the social lens, the mental lens, the physical lens, it doesn't matter. If you really believe that, that's a fantastic place to be in. But what I'd ask you to do for the next few minutes before I head back to Wolfgang is think about the boardroom in your organization today. And if you were sat there asking this question, because this is what I did recently for a particular organization, and it provoked some of the best debate I've had for 30 minutes with a client, because actually the answer is not that straightforward. And I wonder how you would think about that in your organization. So we'll revisit that again in a moment and talk about the solutions. But we've been looking at some research, because that's the question we posed ourselves. And I want to just pass back to Wolfgang to take you through some of the background and some of the early findings that have come through from that.
Thank you, Nick. And thank you also for instigating that research. Now it becomes really exciting here, actually. So let's go through what we want to achieve here. We want to move from A to B. We saw all the big system of decline. How can we get to a system of recovery? And shall we use the good old-fashioned methodology, or are there new things? So the research was fairly authoritative. You see 2,500 participants, a relatively acceptable gender balance, and all people at working age and being in employment indeed. So the population we wanted to look at. So what we were interested in is to say, what more can we do? Because once we have the data and all that wonderful ROI, why is nothing shifting? Why don't we see a change in epidemiology, i.e. the incidence of those disease patterns that we described before? We wanted to know, what does personality have to do with it? What's my health identity? And you can imagine it's sort of built up over years, over decades. You know, past experience with healthcare shapes the way how I look at things. What pushes my buttons? What type of communication works for me but doesn't work for Nick, or wouldn't work for my mother, for instance? We are different people, so obviously we are not responding to the same type of communication in the same way. What would be more likely to engage us in health behavior? Some organizations need an element of competition, others hate competition, so it depends. What influences our expectations in terms of how we might be getting better or not? What are our health outcomes? What does our current status of health have to do with the way I look at mental health interventions vis-a-vis physical interventions and so forth? So ultimately, it's about a culture of health and well-being. So now, there is 500,000 data points, so we are just writing that down for you to sort of be confident in what we are talking to you about. But also, all those elements that I was just talking about are associated with those various pillars of well-being. And as a minimum, you usually have mental well-being, physical well-being, social well-being, and financial well-being. Some of you have additional ones that could be subsumed under those 4 pillars, like environmental well-being or occupational well-being and sense of purpose, to name but 3. But those are the interesting pillars that we want to look at. And now the outcome of the research. So now it becomes a little bit psychological, with your permission, but really, really exciting. So we see here now that a one-sided one-sided, bucketed well-being strategy doesn't work and doesn't address your people's needs, because you have people who are holistic, as the horrible word goes, entities, integrated entities. You know, I keep saying there's no point in having hospitals for bodies without souls and other hospitals for brains without bodies, because you can't divide between them. And almost any disease you can think of has biopsychosocial components. So we want to look at that first as well. And then we want to see what's people's motivation to change. So one very interesting insight finding from this research is that people are twice as likely to state physical well-being over mental well-being as the key to happiness. Isn't that interesting? Doesn't mean that it's true, but it's just what people expect. If you ask them what's going to make you happy, they say, well, physical well-being is crucial. And then they say financial well-being is very important as well. And then they say it's mental well-being, and then they say it's social. So really, really interesting to look at those as well. And, you know, in my practice as a psychiatrist, I have counseled people who are lottery winners. They are not necessarily as happy as they predicted they would be. So that is just one point I wanted to throw in here. Then, of course, almost everybody believes that well-being is important, and 70% roughly of the survey we conducted say, I want to change my behavior, I want to become healthier. But the initiative breaks down very quickly. About 30% of them continue in the face of adversity when you are trying to go through your health regime, but the others give up very quickly. So health is personal and it is complex. It's also interesting to talk about culture, and we learned so much from Lucy's presentation that I hardly dare to add anything to it at all, but rather than summarizing that it's quite rewarding for us reward professionals to see that the millennials and the even younger generations coming into the workplace pay an increasing attention to the well-being services on offer in the organization. It's also interesting for you to know who do people trust when they want to talk about health and well-being. So we have good stats on that one as well. So we know that it's still the NHS, the number one that people would go to and trust. Number two is friends and family, and so on and so forth. So the employer, unfortunately, and the EAP and the healthcare services at work come much lower down the ranking order, but at least way above celebrity endorsements, so at least people don't trust those quite so much. And now come the science bits. Now, there is a 5-factor model of personality that says which element are really, really important. So that's openness and agreeableness. And now the 3 ones that are more important: conscientiousness, neuroticism, and extroversion. And it was found in that fabulous research that these 3 have a stronger influence on your health identity, i.e. what you trust that you can achieve health-wise, what you assume about your status of health, than even actual health outcomes, right? And your past experience. So personality is important. So that speaks to what Nick was describing to us. We need a more personalized approach to healthcare. And just for the benefit of time, I won't linger too much on those, but those 3 are super exciting. And if you have any questions later, we can discuss them. I know there are some psychological terms in there that are a bit tricky, like neuroticism, for instance. So that is, if you want to know what neuroticism is, just think about the opposite. If someone has very stable emotions, that's the opposite of neuroticism. Neuroticism is when you are easily depressed, easily overreacting to things, a bit sensitive, and that sort of thing. So just for terminology.
It's the worst word ever, but
the worst word ever, I think. But it is acceptable in a Freudian Austrian accent. It's not acceptable in any other accent.
Austrian and a Belfast guy on the stage, I mean, they probably don't understand the word.
Yeah.
Anyway.
Lucky for us, no?
Lucky for us, yeah. So we're going to revisit this question because it's so important. We've now got this basis of research, but so what? Okay, you know, what can we do with it? Now I'm going to assume that everybody in the room is number 2. Is that fair? Is anyone number 1? I'd like to know. No, I didn't think anyone would raise their hand today. But the boardroom might be slightly different. But let's be brave about asking that question, and let's see what the answer comes back. Because actually, I think it can be a really incredibly interesting conversation about driving cultural change within the organization, putting well-being at the heart of it. But what can you do about it? So if we go back to data anecdotal education platform. Wait for it, clever animation coming up. Did you see it? Good. This is the part that we want to focus on, and Lucy has already talked about mindset today as well. This is a really, really interesting area that we think can offer up a different approach if you truly believe that this is the direction of travel you want to take your organization in. But what does that mean? Well, I'm not the psychologist. I'm not going to profess to be the expert, but what I can do is trying to break it down into chunks and then how we can work with employees as somebody who's done lots of communication strategies to employee groups over the years. And so what we think about in those three senses are three things. The first is warming people up. And actually, whenever we're talking about this in the context of the client conversation I'm having at the moment, this is about being really transparent, because what you're trying to do is create a zone, a trust zone with your people, a safe zone, that actually, if we're going to talk in the workplace about finances, if we're going to talk about mental health, if we're going to talk about exercise and nutrition and mindfulness and so on, then your people need to feel safe. Going exactly to the point that Wolfgang's just mentioned, unfortunately, the employer is not that high up on the trust scale compared to some other sources of information. So warming up is really important. So that means when you're starting the communication journey with your people, it means being transparent. It means being honest. If the answer was number one, and you are just, doing it because everybody's doing it, do you know what? Just tell them that. You'll actually probably have more success or as much success than if you try and fudge it, because people understand when you're fudging it. They know it. If the answer is number two, but there might be some business benefit that you're seeing out of it as well, so we do genuinely want to help you, but we also recognize as a business that we might get something out of it, a return on investment, because you're more productive and less absent and so on, tell them. Be clear, be transparent, because that way they know that when you are starting to launch the products and the services and so on, you're doing it because you care, but you're also doing it because you think it's going to be better for everybody. Be transparent about that. Sensitizing is really about recognizing we're all human. Exactly to the point about extroversion, about neuroticism and conscientiousness, and the conscientious neuroticism one is really interesting when it comes to financial well-being. We did some extra research on this last year, which brought out some really interesting findings. We need to recognize that everybody receives information in a different way, that everybody is very different, and that actually Wolfgang and I are different people, and the way to communicate to Wolfgang is different than the way you need to communicate to me. Now, you may not be able to be in a position to capture personality tests for every single one of your employees, although watch this space, that might be something that comes down the line. But you can start to vary the style of communication so that you're doing it in a variety of different ways to capture a bigger audience. Because guess what? As an industry, we're really bad at communicating stuff in a very serious way that appeals to conscientious people. But yet, probably 30% of the population are generally considered high conscientious. So we're naturally excluding a lot of people in the way that we communicate. And then the final one is behavioral change, which is the holy grail. Nice animation again. Which is moving from serious to fun and playful. Again, think about these topics. They are generally considered quite serious topics. Finances, serious. Pensions, serious. Mental health, a serious subject. Of course it is. But when you think about any communication strategy and anything that's been truly effective, whether you look at that at a consumer level or an employment level, when is serious really worked? Not very often, I would hazard a guess. But when has fun and playful worked? A lot of the time. And creating that safety zone, that trust zone, and having your people know that they can talk openly in the workplace, and therefore you can encourage engagement through a much more fun and engaging and playful way of talking about these subjects. And there's lots of interesting ways to do that. We're utilizing business celebrities as an example. You've all got them. They're the people in the organization that everybody knows and so on. If they can come at it and talk openly about things and do it in a fun and playful way, the chances of getting wider engagement with your people are much more successful, we think. Mindset's important. And actually, I would apply this into anything that you do in business. This isn't a wellness thing. I'm using this exact approach at the moment to change the mindset with our sales and growth community within our business. We need to take them on a different journey. It's the same principle. It's warming them up. It's telling them why we're going to go on that journey together. It's making sure that we communicate in a personalized way to everybody through the sensitized approach. And then it's ultimately leading to a way that we can create a zone where people feel they can experiment and challenge themselves and push themselves. It's no different. That's the secret, we think, to really trying to achieve that difference in well-being, rather than possibly just paying a bit of lip service to it through products and so on.
Just to mention a couple of examples, really, you may think you need to psychoanalyze your people to know how neurotic they are or how conscientious they are. That's not necessary. I mean, again, Nick has started playfully developing a prototype of an app that draws you in by just playfully assessing your personality traits. And again, to put more flesh on the bones, and we just skipped the last theoretical slide and linger on this one a little bit longer. If you think about what it means, conscientiousness, again, let's come back to my mother again. She might need like 6 months of drip feeding on financial investments before she can make up her mind and really feel comfortable parting with her money. An outgoing chap like Nick would probably only judge it on the basis of how exciting the opportunity is and be very quickly in signing up to it. So it's relatively easy to do. And also then, there's a lot of tricks in terms of behavior change. If I may just show you just a picture, and without going into it, that we could be discussing as well. That is sort of a way of how you address any kind of target behavior that you want to change. The only message I want you to take away from this one, if I may, is it doesn't work just with one alone. Motivation is not enough. Motivation breaks down very quickly. We heard that in the previous speech as well, when you start going to the gym in January, but you don't do it further down the line anymore. You need all 3 elements of behavior change to be in place, which is capability. So you need the skills, you need the right type of behavior, the right type of attack for what you want to change. You need the opportunity, and you need the motivation. And motivation, of course, can be achieved by really playing to these psychological insights that we know about people's personality and how that is linked to their health behaviors. So I think that is probably it, and the social aspect is huge. If you think about somebody who says, okay, I need to lose weight, or I need to exercise more because of my back problem, so I go to the gym, and then they find themselves surrounded by people that are all slim and fit, and they are put off by it. There is, again, a social context that can be built by saying, why don't you go in a group? Why don't you bring a friend? Many ways of making sure that all 3 elements that facilitate behavior change, capability, opportunity, and motivation are indeed in place. And the other one, of course, that is the science of forming habits. If Thursday is always my gym day, I don't need intellectual willpower or anything, because I come home and I go to the gym, the personal trainer is waiting. If I wait for willpower to emerge because I ask myself, oh, am I in the mood or am I not in the mood, I will fail miserably. And of course, other people have different trigger points. So what it brings us back to is really the big story about what am I motivated to change for? What's the higher purpose of it? What's the emotion attached to it? And how much of that emotion emanates from the type of character or personality I am? And if I capture all those, then I'm much more likely to be successful.
We'll stop there. We've run over, but thank you very much for listening.
Thank you.
Okay.